Assalamualaikum warahmatullahi wabarakatuh. Hi friends, welcome back again with me Akvina Alia Rahma from Computer Science Education Class B, Indonesian University of Education. This time, I am talking to you about sleep disorder. Have you ever found it difficult to sleep, always wake up at night, and have trouble sleeping, wake up too early, feel tired and sleepy during the day, have trouble concentrating, or snore, choke and gasp during sleep, and unstable emotion? Beware, those are the symptoms of a sleep disorder. Sleep disorder is a disorder that makes sufferers have difficulty regulating sleep patterns. The characteristics of people with sleep disorder include waking up not refreshed, quickly drowsy, difficulty concentrating, tiredness, and memory decline. Sleep is something needed by the body. Maintaining good quality sleep is something that needs to be done because it is beneficial both physically and mentally. Do you know that one of the benefits of sleep is to increase one's cognition, productivity, and concentration? Even in a study compiled the Journal of Child Psychology and Psychiatry, a child who gets enough sleep will excel academically and behaviorally. In addition, adequate sleep can also reduce the risk of heart disease and obesity, regulate calories, strengthen the body's immunity, reduce inflammation, and prevent depression. In fact, referring to research conducted by the American Cancer Society, to 1.1 million Americans found that those who slept 7 hours a day had the lowest death rates. However, it cannot be denied that some people still have sleep disorders. So now we just go straight to the types of sleep disorders. The first is insomnia. Insomnia is a condition when you always find it difficult to sleep or take a very long time to sleep. Insomnia can be caused by bad bedtime habits, mental disorders, or certain diseases, one of which is pineal disorders. There are 3 types of insomnia, including transient insomnia that you can't sleep for a few days, for a few nights, certain insomnia that 2 or 4 weeks of having trouble sleeping, and chronic insomnia that experience almost every night for over a month. The second is hypersomnia or narcolepsy. Hypersomnia is a condition in which the need for sleep is very long, so the sufferer is always sleepy during the day. There are various things that cause hypersomnia or excessive sleeping. One of them is depression. This habit can also be influenced by feeling of tired because you have been working all day. Have you ever experienced it, or you have seen someone who always sleepy during the day? Next, the third is sleepwalks. Sleepwalking, with the medical term somnambulism. Patients with the condition often wake up, walk, or do various activities in a sleep state, but they do not realize what is being done. The fourth is a nightmare. A nightmare that occurs when the brain makes a person dream of troubling things. The cause of nightmare is not yet known. However, nightmares that occurs in children are thought to be triggered by anxiety or fear of being away from people. The fifth is sleep terror or parasomnia. Sleep terrors are more common in children, especially those aged 4 until 8 years. Sleep terror sufferers look scared to scream while sleeping. This condition can be triggered when the child has a fever. The sixth is sleep apnea. Sleep apnea is a kind of sleep disorder in which the shortness of breath occurs while sleeping. Sleep apnea is very common. Sleep apnea can appear in all age groups and sexes, but it is more common in men. Sleep apnea occurs when a portion of the upper respiratory tract becomes blocked and temporarily blocks the breathing process. This makes sleep apnea sufferers awake during sleep and will feel very sleepy during the day. This can also cause narcolepsy. The seventh is sleep paralysis. Sleep paralysis is a condition where you feel suddenly paralyzed during sleep. You can't move, can't talk, and even have a hard time to getting up from sleep, and you realize what is going on. If you feel you have those sleep disorders, then steps you can take to cure you are: the first is you have to change all your lifestyle. your flight hours, the foods and drink you consume, do not smoke, and maintain your sleep patterns. Then you can go to psychotherapy to undergo cognitive behavioral therapy to change your thinking patterns. If you have trouble breathing, you can use special tool when sleeping. The device consists of an oxygen mask connected to a device called Continuous Positive Airway Pressure or CPAP. CPAP therapy is useful for keeping the respiratory tract is open. The last resort is to take drugs, such as sedatives and antidepressants, and must be according to a doctor's prescription. Okay, maybe that's all from me. Thank you for watching my video. See you in the next video. Bye.